In 2010, the Affordable Care Act put an end to the lifetime and annual monetary limits within healthcare insurance policies. This law is allowing the patients to seek medical attention when they need it without fear of bankrupting their families. I work on the medical telemetry unit where most of my patients have multiple systemic issues that cause them to become hospitalized at least a few times a year. A majority of my patients go through a cardiac catheterization where interventions can't be performed unless the artery is occluded to at least 80%. Those patients who have blocked arteries but aren't to the 80% mark yet will have to return within a few years to get those blockages addressed. For a patient who has undergone minor heart surgery and will probably need it again in the future, it's important that there isn't a limit to how many times they can seek medical attention. People are sometimes hesitant to call 911 or to go to the emergency room due to the overwhelming cost, which is what helps support the need for a change in the healthcare system. Too many people weren't able to get the healthcare at an affordable rate, and some people who lived with serious medical conditions had to switch plans regularly in order to continue being covered. Prior to the implementation of the Affordable Care Act, insurance companies had a set dollar amount for what they'd pay for the entire time someone was enrolled in one of their plans. They also had a set annual limit that a person holding the plan would be responsible for if the cost of their care exceeded the limit. This means that if a patient were to require medical treatment after they hit their coverage limit for the year, they wouldn't be covered at all by their insurance. Prior to the Affordable Care Act, 59% of workers covered by their employers and 89% of people with individually purchased plans had some type of lifetime limit placed on their benefits. There has been about 105 million people who have benefited from this change. Of the 105 million people, 75.3 million are non-Latino white, 11.8 million are Latino, 10.4 million are African American, 5.5 million are Asian, and approximately 500,000 are American Indian or Alaskan Native. Approximately 28 million of those benefiting are children, with the remainder of the 105 million split almost equally between adult men and women. In Virginia alone, 2.9 million people are estimated to benefit from this change. I brought this issue up with a social worker at my hospital to see how this change in the healthcare system has affected her work. She said she has seen more consults put in for her since the ACA has been passed and that she's noticing the hospitals have more patients in them. She noted that when she became a social worker, she didn't have nearly as many patients to cover, and she thinks it's because there are more people that are able to come to the hospital now that they are covered under insurance. The issue with more patients is that there's still the same number of social workers working with the increased number of patients, which makes her job a little bit more difficult because she feels like she's being stretched too thin. In 2010, the Affordable Care Act eliminated the lifetime and annual limits on healthcare coverage for Americans. These changes have already been integrated into my clinical area and is already improving upon my patient outcomes by allowing the patients to seek medical attention when it's needed rather than when they can afford it. I've had patients who have mentioned not wanting to tell anybody about their chest pain or shortness of breath because they didn't want to have to come to the hospital and deal with the bills that follow. These changes mean that people in the community are more inclined to get help when they need it, thus enhancing their quality of life and their overall outcome. In conclusion, I found the changes to be a very big positive for the patients because it allows them to get help when they need it. It's also a positive for the healthcare workers because now we know more people are getting the help they need, which will make our society a better one to live in.